Couple yeses. Awesome. Cool. Thank you, everybody. Well, again, my name's Mitch Winans. I'm a special assistant in the IRS Chief Procurement Office, and I'm the government chair of the RPA project team. And on behalf of ATARC and the entire AI working group, I wanted to say welcome. Thank you all so much for joining us here today. This is our first webinar for this group. We had 3 in-person events so far this fiscal year in the fall and the winter, talking about different automation and AI use cases and how they can be impactful and applied to different government agencies. This working group is a great mix of government, industry, and academia participants. So very, very excited to be able to have this digital virtual type of environment. So thanks again to all of our attendees. Big thank you to all of our speakers and our moderator. We got a great set of speakers from government and from industry that are going to be able to speak and tell us a little bit more about how they are leveraging or using automation or AI to support the response to COVID-19. So very thankful to all of you and all of your time. Also wanted to thank everybody at ATARC for putting this together. It takes a village. There's been a lot going on the last couple months with shifting events from in-person to virtual. And again, could not have done it without everybody at ATARC. So wanted to say a big thank you to Kirsten Patton, Maddie Keller, Alyssa Cole. There's several other folks as well that are doing some really important, meaningful work with ATARC for the government and industry and academic communities right now. So wanted to acknowledge them. Also wanted to acknowledge anybody that has been directly impacted by COVID-19. I know it's a crazy time right now, so I hope all of you and your families and your coworkers are staying safe and staying sane. I know it's been a big adjustment for everybody, but we are grateful that we're able to still be here today and have some positive, helpful interaction and networking in this new digital environment. Also wanted to specifically recognize anybody that is directly involved with supporting the response to COVID-19, and really specifically to recognize those that are running towards the danger rather than away from it. Folks that are first responders, healthcare professionals, anybody involved with the food supply, grocery stores, freight, shipping and distribution, caregivers, anyone at all, whether it's you on the phone or somebody that you know personally. I have some close friends that run a grocery store in the Los Angeles area. They've been working their tail off long days and weeks for the last couple months. So just wanted to recognize all of you and thank you for everything that you're doing and continuing to do. With that, I'll go ahead and pass it off to our fantastic moderator, Ron Schmelter of Cognilytica. He's also part of the leadership team for the ATARC AI working group. And he'll be able to kick us off and introduce our great panelists. And again, we look forward to a great discussion today. So thanks again, everybody. And Ron, I'll pass it off to you. Thank you.
Well, hello, welcome, and thank you everybody for joining us on this webinar. Hopefully you have signed up and you're relaxing in your work from home environment, or you're in the midst of getting what you want done, and we're really thankful that we could spend part of your day with us. So we really appreciate your participation and your time. And for those of you that are listening to this on replay, we appreciate your listening to us as well. Well, we have a fantastic panel lined up for you here today of both practitioners from the government as well as technology solution providers and industry folks who are putting into practice a lot of the technologies around automation, artificial intelligence, and all the aspects of trying to help the government respond more effectively and more efficiently to the pandemic. Obviously, we have the pandemic as we're dealing with it right now, but hopefully there are lessons learned from this that can help us deal with future changes. And in many instances, the pandemic is really one of those instances of having to deal with rapid change. And as we all know, the government is not necessarily always seen as a place that can respond quickly and agilely and nimbly, but we don't really have much choice. So there's a great role for technology to play here. Before I get things started, I also wanted to give our hosts at ATARC an opportunity to welcome everybody and tell us a little bit about, for those of you that are not familiar with the scope of what ATARC is doing. And then we're going to have the panelists. We're going to have them introduce themselves one at a time, and then we'll get things going. We have a bunch of questions, and we'll talk a little bit about the flow. We also have some polls as well. So perhaps, Maddie, did you want to say anything first on behalf of ATARC to welcome our attendees here? Okay, actually just got a message. She will probably join us later. Okay, so
no problem.
that's all right. Hopefully you're all very familiar with ATARC and the great work that they do as part of this whole event. And in particular, we have this working group, and that's what these members here are assembled as part of the RPA working group that Mitch mentioned. So let's go around and perhaps let's start. I think I'm going to go to Glenda Conroy here. She's on my left. This is a little bit of the all in the family thing situation, or not all in the family, the Brady Bunch is actually what I was thinking, where we have all the pictures around us. So perhaps Glenda, why don't you introduce yourself, then we'll go to Doug, Stacy, Mitch, and Jan, and then we will get started with questions. And I also want to mention that this webinar is for you. So we have a bunch of questions that we've put together on this topic, but we encourage you all to be highly interactive. Post your questions in the chat, and we will definitely get to them during this event. So let's start on my left, Glenda Conroy, if you would like to introduce yourself and talk a little bit about the role of automation and what you're working on.
Okay. Hi, everybody. I'm Glenda Conroy, and I'm the Deputy CFO and the Director of the Office of Financial Management at the National Institutes of Health within the Department of Health and Human Services. I have been in this role for about 5 years, and of course in financial management, I direct and oversee the accounting function for the 27 institutes and centers at NIH, and we have an annual budget of around $40 billion. Prior to leading NIH, I have worked at a few other offices in NIH, covering things like risk management and policy, program integrity, and also served as the executive officer at the Institute on Drug Abuse. Prior to that, I worked at the Program Support Center in Health and Human Services, the Food and Drug Administration, and earlier than that in my career, I was in the private sector. That's a little bit about myself, and then sharing what we are doing at NIH. So basically, we've spent the last few years, and I've been directly engaged learning about RPA and getting the framework in place at NIH to include selecting software, putting hardware in place, getting the authority to operate, and all of that framework that's so critical to any IT solution, but especially to engage this new technology. We had been ready to go live and pilot the RPA with the IPAC solution, but then whenever COVID-19 came about, we switched gears and focused all of that effort on our commercial payment side. Specifically, we're lined up with the department to move to Treasury's IPP, electronic solution, but in the interim, we needed a short-term solution to be able to receive our mail electronically. So we receive about 10,000 invoices a month in that manner, particularly, and we, within a short time frame, refocused our team, then worked with our contract shop and received our invoices from our vendors. And within the month, we're now receiving about 2/3 of our mail via email and routing it using RPA to route it to the workforce. So we were pretty nimble, and as government offices go, you usually don't do things that quick and sound, but we have, even statistically, I'll be able to share that we have received only 5,000 in that time frame now via the regular mail and scanned it through a tool mark view that we had been using. 10,000 came in email. We were able to route it using RPA. So for a total of 15,000, and 80% of those were effectively already processed into the system, which is the point that then we pick up to the process that we had been using in the past. So that's really our one bot function that we have at the Office of Financial Management at NIH. Many of the institutes and centers are sticking their toe in the water and starting to look at what they want to do with it. But of course, the key is to get the framework in place. And once you get moving with one, then you can look at other opportunities for where they apply to your organization. So that's a little bit about who I am and what we've done with bots at NIH OFM.
Excellent. Well, thank you so much. This has been actually interesting, moving from physical mail to electronic mail using the help of RPA bots. That's great. That's digital transformation in a nutshell. Fantastic. So, Doug, down to my bottom left there, if you'd like to introduce yourself, tell us a little about your organization and the role of automation in what you're doing.
Ron. Be glad to. Greetings from Nacio, National Association of State Chief Information Officers. Some of the folks in the audience may not be familiar with us. We represent state government. I'm here representing the states and the state CIOs and the territories in the District of Columbia. We represent all of them. So all the states, territories, and DC have a Chief Information Officer. They are the lead IT executive for the executive branch. They're all appointed positions, and Nacio represents them as an association. Last year, in 2019, we celebrated our 50th anniversary. So we've been around for a while representing the state IT community and what they do. And we are a standard classic association in what we do in terms of supporting our members, supporting generally the state IT community across the board, supporting the leadership initiatives of the state CIOs, providing them with research and support, policy analysis, and that obviously hold conferences. We used to hold conferences. We'll see how it goes. We canceled our mid-year conference in just a week ago and did a series of webcasts. So we're looking forward to that. And we're going to do a series of webinars, webcasts throughout the summer to kind of pick up on what we missed. So that's a big part of our community, is the networking. Each year we do a number of kind of seminal national reports. We're the one organization that really speaks for the voice of the state CIOs and have a lot of data. And by a lot, I mean data from the last 15 or 16 years where we have longitudinal tracking on some key issues. One that we started several years ago was looking at the adoption of emerging technology and kind of a stack of what you would consider to be, at that point anyway, kind of the classic emerging technologies kind of around the board. And we looked at things like, AI in a broad, I would call it the kind of a broad bucket of artificial and augmented intelligence with machine learning and RPA and chat bots and digital assistants, et cetera, natural language processing. We put that all in a bucket. We also looked at Internet of Things, IoT, autonomous vehicles, connected vehicles, quantum computing, unmanned aerial systems, vehicles, blockchain. And we continued to ask the state CIOs their perspectives on what emerging technology would be the most impactful in a rolling kind of next 3 to 5 year spectrum. And what we've seen over the last 3 years is that the AI stack has jumped to the top of the list. In 2019, 65% of our state CIO, and those were all of the state CIOs responding, said that AI and that kind of whole bucket of AI technologies would be the most impactful. So it surpassed IoT and blockchain by a pretty broad margin. Those continue to drop while AI continues to rise to the top. And again, we have a lot of data around the baseline, even in 19, asking states how many of them intended to deploy some type of automation software, either RPA, machine learning, or something similar. And again, about a quarter of them said they had already deployed it or in progress, and another 25% said they had planned to do that. So again, 50% kind of in that yes category, others kind of looking at that perspective. So we've done from that base survey, the data we have, we've done other national surveys, including one with IBM and Center for Digital Government, released in October of 19, and that looked at just a deeper dive into the whole AI stack and looking at all those technologies and where the states were. And so I'll talk about that later in terms of some of the results we found. And I think the surprising speed of adoption during the pandemic response. So that's one thing I can address when we get to the questions, is I think the extraordinary pivot the states have made enabling some of the technologies and response. They clearly still have some issues with legacy modernization and delivery of citizen services from some of these legacy platforms. But I think when you look at areas like remote work and digital government, general just automation across the board, cybersecurity, scaling, particularly of some of those systems and video conferencing and call centers. It's been pretty remarkable how fast states who said 6 months ago it would be difficult for them to go into a remote work environment or a work from home environment. We now have states where 95% of state employees are actually working from home. And so it's been pretty, like I said, a pretty remarkable turn. And I'm proud of how fast the states and the state COs were able to do this. So just some opening comments from me, Ron. Thank you.
Thanks. Good. Sounds good. Well, maybe we can share some of the results of those surveys and share some of those webinars with our attendees. So it'd be great to get more information sharing. So below me, for on my view, perhaps above you on your view, we have Stacy Dawn. We can have her introduce herself, tell us a little bit about the agency, and of course, where they are in their automation path as we stand today.
Good afternoon, and thank you for joining us today. I wanted to let you know I started civil service 23 years ago. It's amazing how so much time has taken place, and now we have robotic process automation to help us get so much of these things done that took so much time before. Now I'm working for Housing and Urban Development. I'm a former CISO and Assistant Director for Privacy and Security Compliance. So as we implement RPA at our agency, it's really of the utmost importance that we take security into concern, and working on the ATO package, making sure that we have continuous monitoring, that there's separation of duties, how we're going to handle unattended bots with two-factor or multi-factor authentication, ensuring that unattended bots don't go rogue on us, that somebody can't inject an unattended bot into our systems. Centrally managing the RPA program at HUD is also of the utmost importance. And I'll talk to you a little bit more about that as we get into the questions. Thank you very much for having me on the panel.
Thank you. We really appreciate having you, giving your perspective, and we know it's going to be a lot of great insights. So attendees, get your questions queued up. So at my bottom right here, I have Mitch Winans, who's with the IRS, and he's the government chair for the RPA working group here at ATARC, and helped make this event happen, kind of spurred us to action here. So I'll have Mitch introduce himself, tell a little bit about what's happening at the agency and what's happening around automation, and we'll keep things going.
Awesome. Thanks, Ron. Again, my name's Mitch Winans. I'm a special assistant in the IRS Office of the Chief Procurement Officer. I manage strategic planning and customer experience initiatives for our organization. As part of that, I get to look at how different tools or technologies could potentially help us support our employees and improve their experience, make things easier and more impactful for them. Also, how we could potentially drive some efficiencies in our organization, supporting not only goals that we have in our procurement shop, but also broader IRS strategic goals and initiatives, things in the President's management agenda. In general, just helping support our employees look to the future of work and kind of the future needs of our organization, and things like that. And so as a part of that, I get the good fortune to help explore and integrate some different tools or technologies that we can leverage in our procurement organization, but also making sure that we're being good, smart business advisors for other parts of the IRS or Treasury Department that are procurement customers and may have a similar type of need or some product or service or tool they need to help do their job. And it's our job to help them with understanding market research and marketplace capabilities and what are some of the business models and contract types, things like that. What are we seeing out there? So again, anyways, very happy to be here, honored to be here. Ron, I think in general, I'm not going to be quite as active as a panelist as Yen and Stacy and Doug and Glenda. I want to be able to focus on the four of them. So just wanted to mention that, but I'm happy to be here and look forward to the conversation with everybody else. Thank you, Ron.
You got it. I'm going to unmute myself. You got it. Thank you so much for participating. Without you, this couldn't happen. So any contribution is fantastic. And when we get questions queued up for Mitch, I'll make sure that he's responding to that first. So my final panelist here to my right, you're somewhere, is Yan Chao. Thrilled to have you here. So introduce yourself and talk a little bit about your role and what's happening with automation.
Great. Thanks, Ron. It's a pleasure to be with you guys. I'm a physician based in the San Francisco Bay Area near Silicon Valley. I spent over 30 years at Kaiser Permanente, the last 8 years as a National Director of Innovation and Advanced Technology, where we actually evaluated over 2,000 health IT startups, including mobile, telemedicine, and analytics, and we ran a large innovation program. Fast Company magazine gave us the award as the world's most innovative healthcare system that year. I left in 2014, became the Chief Innovation Officer at a Washington, D.C. healthcare IT firm, where we introduced new technologies to the VA and DoD. And then after that, I joined Amgen, a biotech company, as their lead for digital medicine. And in that capacity, we ran virtual clinical trials, looked at wearable sensors, analytics, and digital biomarkers. Finally, I joined Automation Anywhere, one of the major enterprise automation RPA vendors, a year ago to help launch the healthcare industry vertical. And it's a real pleasure to be here. Thank you.
Thank you very much. Really thrilled to have your perspectives on this panel. Okay, great. We have the panel results here. Actually, the poll results. We actually have some polls that we're pushing to our audience. We're going to pull. We have about 6 polls, so you can see the results here. So currently, most of you have automation in place in your workplace, which is great. And actually, that does bring us up to our first question that we have queued up here, and we're getting questions queued up. So please do enter them as well in the Q&A box. So the first question has to do with the pandemic response, which is kind of the thing that's sort of spurred this panel to happen. And the question is, have you seen any automation efforts accelerated or expanded or even initiated in the face of the pandemic response? And I'm going to start first with Doug. I know he's got some things to say on this topic, and we'll kind of move to Glenda, Stacy, and Yan as well as we sort of move along. So go ahead, Doug.
Yeah, thanks, Ron. And as I kind of alluded to in my opening remarks, from the state government side, and I'm speaking across the board for all the lines of business, for all the major agencies, particularly those that are focusing on COVID-19 response, based on what we're tracking and based on some of the data we had with a very contemporary 2019 survey looking at automation and AI adoption, we're definitely seeing an expansion and a very quick adoption in areas that state government had not used before, particularly for some of the AI tools. And I think most importantly, I would say probably in the AI-enabled chatbots, we had states with chatbots, but they were not AI enabled. They were fairly routine, and now we've seen those really ramp up to keep up with the demand. So we've gone from again, about a quarter of the states with about another third looking at proofs of concepts or maybe starting some demonstrations in late 2019. But again, only probably less than 10 states, 7 or 8 states that indicated they were currently in production in some type of core line of business, and that has increased dramatically. When you look at these core line of business, we're talking about, I think, 4 or 5 major areas for the states. First and foremost is probably in the health area and pandemic response, and we're seeing a lot of states that have deployed particularly chatbots and other type of what I'll call virtual agent, virtual assistance technology to answer general pandemic questions. A lot of questions coming in from citizens. And I'll point out that there's both internal and external. I'm going to focus a little more on citizen facing services from the automation side. And that's what we've seen adoption, but we still have states that are using internal as well because they've seen such a shift in the nature of the workforce. But on the other end, I think in terms of health, one that's probably gotten the most attention in the last 2 months or so is unemployment claims, UI claims processing, UI questions. And again, given the massive crush that the states have seen in some instances, 2,000 to 3,000% increases over their baseline, where they're handling tens of thousands of inbound, either website claim processing or the attempt to do that. And then of course the call centers. And so they're doing whatever they can using AI-enabled chatbots to be able to at least ameliorate some of that and answer some of those questions. The third big area is probably in the tax area, and then general, what I'll call general human services and welfare. So questions around child care and daycare and elder care and nursing homes and things like that, where people have general questions. So I'd say the answer, the basic answer is this: we've seen an expansion. There may be some RPA projects focused on back-end business systems that perhaps have been slowed down or delayed, but there's definitely a significant increase with certainly areas like chatbots and digital assistance. So we have a number of states that had already had in play for several years connections to Alexa on their websites. And so states like Utah, Mississippi, and others were already using the digital assistants to be able to help citizens navigate services and answer general questions based on their frequently asked questions set, but that's accelerated during the pandemic. So I think a fairly quick turn, and saying there are a number of states that have multiple chat bots and other capabilities to automate what I'll call the digital governmental digital services channel. So that's kind of the opening data that I have. Thanks.
Yeah, thank you very much. A great insight. And we don't really hear a lot about what's happening at the state and local level, especially because a lot of the federal stuff gets visibility and the state stuff tends to not get as much global visibility. So it's really great to get that perspective. So speaking of AI and automation projects that have gotten accelerated or initiated as a result of the pandemic response, Glenda, your use case sounds really intriguing because it's the kind of thing that you would never have thought of, which is like taking print mail and digitizing it because you have people who work in the office. Why would you need to do that? And of course, like, oh yes, we have these situations where workers are not working in the office. And so this is a situation where you have a use case that comes up now, all of a sudden it's really urgent. You have to solve this problem. People have to get their work done, but they can't do their work in the office. So maybe you can tell us a little bit about this project, how it got kicked off, how it got initiated, maybe the time frame from it. We have a question from one of our audience members who are asking maybe about the technology, if you can mention that, the technology that you're using for that. So maybe you can guide us into that and maybe kind of where you see other projects getting expedited as a result of this pandemic response in general.
Okay, sure. And again, my responsibility as the deputy CFO is secure money along with the IT. And so in that regard, the area that we really wanted to do our part with when this COVID occurred was to support the supply chain. So again, as I mentioned, the NIH is a $40 billion a year organization. Now, a lot of that money is grants. And the grant payments go out through another organization, but we have to do the accounting on that. But particularly with the commercial payments, we'd be focused more on paying contractors. And if we would get hooked up with not being able to process those payments, not getting them into the financial system, then it would definitely bear on us being able to get the payments out the door. So in that regard, we had across the organization, because a large organization, we're very dispersed across the organization, the different mail routing, vendors not wanting to have to necessarily participate in that routing process. They wanted a solution to be able to just get the mail, get the invoices to us without using the mail system. And also there's a process if you have live cases, even employees or someone, then you do the contact and you decide what you have to do to either shut down or clean the building. So if our mail area is exposed to that, then we have those types of issues that while the building's not accessible, we're not keeping the vendor payment process moving along. So the way we managed it was we actually built intelligence into the subject line of the email, because the primary factor is actually routing the invoice to an employee's email box so that we just don't get 10,000 invoices and communication and, hey, can you pay this fast? Those types of things all coming into an email box, and then us actually complicating the problem in a way that was really dysfunctional instead of functional. And so what we did was we worked with our contracts, our central contracts office, who communicates officially with the vendors. And then we guided them to build intelligence into the subject line that would speak to whether their invoices were things that matter to us, like whether they were two-way invoices for receiving or three-way, depending on the type of a product or service that it was. And then based on even like a breakdown of the alphabet, we would be able to divide those that information coming in, those emails, into work boxes, so that then it would be an organized manner for the staff to be able to then access those new work boxes and along with what was still trickling in, or, at first it was coming in still heavy through the postal and the scanning, we were able within a month to have 2/3 of it coming in through email because everybody was motivated to want to go that route. Not that they really didn't want to go that route earlier, but we were participating in a bit of a slower moving project with the department to move to a long-term solution, which was Treasury's electronic process. So through that, usually you want to do your change management before you go into the technology. I'm sure everyone there would agree from all your background, but we didn't really have that lead time. So we were doing it all, like talking to staff, training staff, talking to vendors, making sure they understood, managing what was coming in not compliant, talking back through the contracts office to the vendors and back to the vendors somewhat directly. So over the course of the month, we moved the process to getting ourselves ready to switch to this, switching to it, monitoring it closely to make sure that it was effective, communicating with the vendors, and what to this last week in May, we implemented a dashboard that shows us the breakout of those different boxes, whether the bot is receiving the email and automatically distributing it to the right box so that somebody can start working on it right away, or it kind of gets hung up and it didn't have the right information, so the bot's tripped up with what to do with it. And we've really been able to refine that to the point where we've received, like I said, already 2/3 via email instead of regular mail. And then also 80% of them are processed in effectively, and we keep the payments going out the door. So we're doing our part in the COVID-19 pandemic to support the supply chain that NIH is responsible for.
Yeah, that's important. People don't think about the disruption to the supply chain, not just in the producing products, but getting people paid part, which is important and keeps things going. So Jan, I know you have some interesting insight into automation and intelligence projects that have been accelerated or expedited as a result of pandemic response.
Right. It's interesting when we look across our customers and the customers of other companies and so on. What I've seen is actually sort of a four-phase structure to the epidemic. There's some people that are still going on the up curve, and then there's the peak, and then there's the population recovery, and then business recovery. So I would say at the peak, which is what a lot of us have just gone through, most providers have been completely focused on the needs of COVID-19. The demand, the inventory, the supply chain, the cooperation, things like that. So the kinds of automations that have been, I would say, entertained at the peak would be things like information sharing, which we have seen a couple of examples of in automation, things that help citizens to get a picture of what's going on. And as you know, it's been a huge issue in terms of reliable data, not just here, but in other countries as well. So we've had examples of companies putting up information sharing websites, having bots automatically access data from reliable sites and posting it in an actionable fashion. We've also had a lot of call for a contact center expansion. So not just contact center expansion, but contact center expansion with remote workers. And that really does require, can actually benefit from a lot of automation, both to set up those workers and to give them attended automation so that they can come up to speed quickly to provide answers and solutions. So that's another application that's seen a lot of interest. I would say telemedicine is the big winner. The VA has been a pioneer in telemedicine, as have some of the companies, and I think it's going to stay. I think it's amazing. It took 30 years to get to this point with people pushing for telemedicine, and all of a sudden, all the barriers fell apart. I mean, the interstate licensing, the reimbursement, all the issues about that, because we had no choice. And so I think it's going to stay, not only because it's good for the epidemic, but I think in normal situation, when a patient does not show up for an appointment, you can quickly switch. There's no travel burden, so you can be much more efficient. Other areas of interest for automation, I would say, have been in claims processing. That's a huge area for providers. Not just, it's also the CARES Act claims processing, but it's also the new kinds of processing with federal subsidies for patients and things like that for businesses. And for the payers, healthcare payers, they will have to deal with the economic fallout in the business recovery phase, which means they have to deal with the business disruption, the economic consequences, the financial aid, re-enrollment apparently is a big issue. People falling off employment and coming back on, and of course COBRA issues, dealing with COBRA. But I think claims processing automation is very lot of interest. I think the other thing is that in the epidemic at the peak, most hospitals already have plans to have a command center type of situation, and they actually have contingency plans. What we found out was a real need was that there's not very good cooperation for mutual aid, and I think that's an issue that will have to be thought about, because we actually entered into a project with a local academic center to try to get visibility into the inventory systems of all the cooperating partners, and nobody wanted to allow that. So it was because they're normally competitors, in better times. So it's an issue because it's an issue for information and for resource allocation and for knowing, predicting when capacity is going to be reached and so on and so forth. So I think there's a lot of potential for automation. And then finally, the last thing is that I think COVID-19 has driven the plans of digital transformation. A lot of organizations that were already in motion are now speeding up very much so to try to mitigate any potential consequences. Yeah.
That makes sense. That's good. You don't usually want urgent situations like this with life and death scenario to be the motivation to adopt things when perhaps we could have done so without that. But sometimes it's in crisis, there's a solution. So actually, that's a good transition to our next question here, which is some of the promise for automation. So the question to all the panelists is, what do you see as some of the most promising areas where automation can be applied to solve current and future pandemic responses? And we'll start with Stacy on the response to this one.
So when I was offered the job at HUD, I looked into everything that they do, and they touch most every American. And it's really important to get paid. Everybody agrees, but it's really, really, really important that you get to stay in your home. And so I find it touches my heart to be part of the group that's implementing automation to help people stay in their homes. So looking at the different things that we're doing throughout the pandemic is getting the UiPath set up so that automations can run, and we can make sure that people have the tools that they need so that they don't get evicted, or if they have late payments, they're not being kicked out, and implementing all of those programs that some of them are new. If you haven't heard of the CARES program yet, multifamily housing, ensuring that people can stay in their homes is number one in my book.
Absolutely. It's interesting because I think all of us are dealing with this work from home remote situation in all the facets of our life. We think about the work part, but we have family at home too. Some of us have younger kids. We have to deal with education at home. We have to deal with all these other issues. Many people working from home at the same time, right? We have constraints on bandwidth and all sorts of interesting things. So it's interesting how widespread this is not just the health aspects to it. It's a lot of societal aspects to it, which is why this panel is general. It's like you say, well, what's the response to the COVID pandemic? Well, yes, there's medical stuff, but there's a lot of stuff that has nothing to do with medicine. It has to do with just changes to the way that we're behaving. So maybe Doug, in response to this question on some of the most promising areas where you see automation, because I know you had that survey that was out, and that was out before the pandemic, but now maybe have you seen any changes to perhaps maybe people might answer some of these questions differently about where they want to invest in digital transformation technology?
Yeah, absolutely. So it's interesting that we asked a specific question in our AI and emerging technology survey of all the state CIOs about where they kind of forecasted the greatest opportunity for adoption of automation and automation tools. And first and foremost was cybersecurity. Cybersecurity has been the number one priority issue on the state CIO's top 10 for 7 consecutive years. That did not surprise me that cybersecurity, we've already seen some adoption. I mean, the cybersecurity threat landscape requires AI capabilities just to keep up with the inbound threats. The human analysts just can't maintain enough vigilance and all that. So they're adopting AI tools and advanced data analytics. The health and human services category came in second. Digital experience and the kind of citizen experience and digital services came in fourth. I think those two, particularly citizen experience and digital services, I think the post COVID-19 experience is going to be a significant increase in tools associated with serving citizens. We've already seen that fairly dramatic adoption with things like citizen-facing chat bots and voice bots and virtual agents and digital assistants. Those are some of the first things the states turn to try to handle the unprecedented demand on their services and the crush. They had to find an additional channel, and so they needed to, even the states that had 5 and 10x expansion of their call centers or virtual call centers. They brought in additional firms. They went to virtual agents. They deployed, hundreds, if not thousands, of individuals to answer calls from their home through their soft phone technology. That still wasn't enough. They were being overrun, with 50, 60,000 calls a day. So they moved to chatbots. So I think what we're going to see is, when I look at kind of the future after this experience, is definitely a focus on citizen services, how to streamline those, how to use automation. I think Jan talked about a little bit about the impact on kind of centralized services. I think the emergency operations center in the state, so every state stood up their emergency operations center. And you think about that, traditionally, that's been around natural and man-made disasters, right? It's around tornadoes and floods and hurricanes and hazardous materials activities. And this is very, very different. So they've had to bring in a whole set of new tools. I think we're going to see the impact of automation within the EOC beyond simply using GIS. Is going to be a lot more analytics capability, and we're seeing states kind of already dabble in that. One area I think that is immature, that's going to require, I'm not sure how we bring automation at this, but states and local governments in particular are really struggling with government meetings and the necessity to have open public meetings with citizen engagement. That's very difficult in today's world, where people are used to going to a physical place and being able to comment on government activities. And so, I don't know what they're going to be able to do in the future to be able to, again, ameliorate the need to have lots of people crammed in a public meeting space and have meaningful debate and interaction on public issues. Congress is struggling with that today, as are many other government institutions. So it kind of be interesting to see where that goes.
Interesting insight. It's something I hadn't even thought about. Like that's one of these impacts of distributed remote workforce. Mitch, maybe you wanted to add, chime in here. Tell a little about your perspectives on some of the promising areas where automation can be applied to solve current and future pandemic responses. I know you could chime into maybe a little bit what's happening over there at IRS, but also give us some insight into that.
Sure. Thanks, Ron. So yeah, I think kind of to Doug's point earlier, and awesome responses from everybody. It's so great to hear everybody from government and industry and nonprofits, the different perspectives and challenges and how we can leverage automation to tackle them. But yeah, I think within the IRS procurement organization and more broadly across the IRS, yeah, we're definitely seeing the challenges of shifting the majority of our workforce to a remote environment. There's certainly some heavy demands on our IT systems, and the ability to virtually collaborate is a challenge. As Doug mentioned earlier, I mean, cybersecurity being a major priority for state CIOs, it's also the same for federal agencies as well. And so it's trying to strike that balance between making sure all of our systems and our data and the PII that an agency like the IRS or HHS or Social Security Administration or the VA has, making sure that's protected, but also ensuring that our employees are able to use virtual collaboration tools that are critical right now. And often a lot of firewalls block the ability to use those or leverage those. So again, it's tough. I think, it's kind of a combination of focusing on what matters most right now, and then also trying to stabilize core systems and operations, but then also trying to think ahead and anticipate what's to come in the future. And I think that, if we don't see any, immediate changes right now, I think we are trying to leverage automation as much as we can within the procurement space. I can't speak to the tax services and enforcement side, but trying to leverage tools that help us help our employees focus on what matters most, less of that manual data entry and that highly time-consuming type of activity that isn't that higher value strategic type work, and then so they can focus on more of what matters. So we're definitely trying to leverage a few bots that we have for some compliance check processes in the procurement office. Also a contract clause review tool that helps us make sure we're staying up to date quickly on regulations and policies and things like that. Also looking at a tool that can help us with identifying and correcting errors in data and data act requirements, which deals with financial and non-financial data that's in our contract awards, and some congressional requirements we have for annually reporting on those certain data elements about how we're spending tax dollars, where the money's going, what types of products or services are being purchased, which part of the country or the economy is being impacted. So we're looking at, so we're leveraging automation in those spaces right now. And then also kind of run, and like you and Kathleen and I always joke about, kind of start small, but think big and iterate often. We're definitely just trying to think big and think about the possibilities heading into the future. And I think for me, looking at history provides some context and some comfort, kind of thinking about crises of the past. And how looking at the sequence of events, the crisis happens, whether it's a natural disaster or something else, or an economic calamity. After the crisis happens, then you start to see some attitudinal shifts, maybe across different populations or different categories of people in different parts of the economy. Then after that, you might actually see some tangible changes in the economy or in other things. So for example, an example of new policies that resulted after a crisis, I think back to 9/11. After that, there was much stricter policies around aviation security. We stood up a new agency, the Transportation Security Administration. We federalized the airports, new protocols for people coming into and going out of airports and entering or exiting the country. Also think about, after crises, new ways of working, like we're talking about right now. I think back to World War II, a huge number of women joined the workforce in World War II to help ramp up production in the supply chain. After World War II, that was something that was sustained, which was a very positive, permanent change to our economy. Also thinking about the snowmageddon, the big snow apocalypse that we had in the mid-Atlantic, I think it was 2010. After that happened, the federal government changed its weather dismissal procedures, and then really that's when we shifted to more remote work or telework in the federal government. So kind of a combination of a new policy and new ways of working, and stopping issuing of desktop computers and only issuing laptops, things like that. Also kind of that third area that I think about historically is crises create new ways of consuming. After the SARS outbreak, for example, I think that was 2004, 2005, early 2000s. Forgive me if I'm forgetting, but there was a big increase in e-commerce. That was kind of the rise of a huge opportunity for Alibaba and Amazon and some companies like that. So again, we saw kind of a shift in the ways that people are consuming. So again, just kind of those are some of the things that I think about and that we're thinking about at the IRS and in the procurement space, is how kind of historically we've seen crises. There's a lot of chaos and stress happening in the moment, but think about potentially there may be some new policies or some new ways of working or some new ways of consuming that come out of this in the long run. So thanks, Ron. It's a great question.
Yeah, thank you very much. So we haven't heard too much about what's happening at the Department of Housing and Urban Development, HUD. And I know Stacy has some really good visibility into the future of automation there. And then we have a couple of audience questions, so we'll get into those. But go ahead, Stacy, why don't you jump in and give us a little insight into what's happening in the agency.
So at HUD, in order to manage the program, we're standing up the Digital Services Program Management Office. So if you think about the past, when we all were able to get a credit card and buy a server and stick it under our desk, and then cybersecurity came around and we had to rein all of that in and try to manage it, we are setting this up for success in the beginning by centrally managing the deployment of our RPA solutions. So when you look at how we're setting this up, there has to be an avenue for people to submit ideas, and who's going to create them, what contracts are we going to have in place. So one of the areas of the biggest potential savings is in our Office of the Chief Financial Officer, the OCFO, where some of the processes that have been identified include payroll, accounts receivable, accounts payables, invoice processing, inventory management, report creation, and data migration. Those processes are already in the pipeline. They've already done the bot creation. We don't have them through into production yet, so they're in our stage environment and our test. It's looking to save over 50,000 hours of employee time, shifting their time from low value to high value work. Overall, RPA has significantly improved the quality and timeliness of work at HUD and the way HUD does and will do business. As stated by Irving Dennis, our CFO, the possibilities are endless. The results are conclusive. RPA is here to stay at HUD at least.
Well, great. That's actually a good sign. And we like to hear that because everybody wants to see more efficiency and the use of more automation and great technology. And I think that's great. I mean, we don't want to be seeing, RPA as like a tool that's, got possibility, but we don't see a lot of evidence. That's part of why we have this panel today, is to show what's happening in these crisis type responses, the use of automation, not like the avoidance of it. We don't want people saying, oh, it's too risky. Let's try going back. Now we don't have much choice. That's good.
None of our job descriptions said you will cut and paste, cut and paste,
Right.
cut and paste. So that's what RPA is letting us give up, that repetitive, you don't want to do that work. You want to be able to use your mind and be productive. So it's enabling employees to feel more productive. It's great for everyone, great for saving man hours, great for the agencies, great for the public and everybody. So I'm really happy to be part of RPA here.
Yep. Well, great. Well, we have we have two questions from the audience, and they have one final question. And we have a question for you, Glenda, as well. So this question has to do with the telemedicine. Actually, we had an inquiry on telemedicine, and you were saying that telemedicine is a big winner with automation. And you're right, telemedicine's been promised for decades, right? And now here we are, and it's like, people are having doctor's appointments, and they're surprised, like, let's do this remotely. And people are like, oh, I guess telemedicine's here. So you said VA has been a pioneer. So can you provide some examples of what's happened recently, from a technology perspective that might have kicked things up a notch?
Sorry about that. Trying to remain unobtrusive. I think there have been two areas that have made telemedicine a much more desirable option. Besides the COVID-19 exemptions and allowances. One is that the networks have really improved. So the infrastructure has made it possible to do telemedicine, even though in the past it was not really a limitation, but because of the infrastructure improving, we can now have the second part, which is the remote wearable sensors, remote sensors and things like that. I'm starting to see the use of sensors that can detect, for instance, sepsis, and even things that even on a physical visit you would not be able to detect. So I think there's a lot of movement and thought about making the experience at home, the home medical visit, actually both more detailed, more informative than even a physical visit where you wait 2 hours in the waiting room, you go in, doctor sees you for 15 minutes, barely lays a stethoscope on you, and then you go home. I think besides that, you can actually work at home and you can be seen at home. But in addition to that, there's a lot of automation in terms of the interface that you have with the patient. So for instance, you can have avatars, you can have motion sensing technologies, you can have wearable sensors that are very advanced. And now people are talking about augmented reality, virtual reality, those kind of things. So it's really an interesting evolution as far as where it goes. I think the main problem, the main barrier today is that the medical community hasn't really talked a lot about the framework for telemedicine. It's a whole new skill. It's like almost like its own specialty. There are organizations like the American Telemedicine Association and folks like that, but we need consensus. We need to figure out what is appropriate to see via telemedicine, what's not. What's appropriate to diagnose and what is not. What's appropriate to, what is the level of reliability we should assign to remote data collection, things like that. And of course, one of the issues we had when I was doing remote clinical trials at Amgen was the authentication of participants. In the clinic, you can you see a real person, you can take the real blood pressure. In a telemedicine setup, you don't necessarily have that level of authentication. So I think that would be an issue. But I think the guidelines, the framework, is the next big step that needs to be happening pretty fast. Mm-hmm.
Yep, that definitely makes sense. So thanks, really great question. So I know we have only a few more minutes left in this webinar, and we have a couple more questions. And I have one for Glenda and I have one for Doug, and then we can sort of wrap things up here. So Glenda, the question has to do with buy-in, especially on this automation thing that you put into place. I think you talked a little bit about that, and you were going through the use case. But the question is about was it top down? Was it bottom up? Who sort of brought this? Was this something you were already considering and it just sort of got expedited? Was it just good timing? So maybe you could talk a little bit about sort of like the project you just mentioned about this movement towards email from physical mail, and kind of where this project came from and sort of how it got support in the organization.
Okay, so I'm the director of the Office of Financial Management, but I do participate in the Office of Management where I need to get budgets approved, projects approved. So, I do have authority, and yet at the same time, I still have an avenue that actually officiates my possibilities. And so we did start this process myself. I'm engaged. I'm interested in the technology. I've attended seminars and training, so that's a great place to start. And my deputy is very engaged in this, John Davis, as well as the team. We were able to distribute software training that was available out to the staff to help them to embrace it rather than see it as a threat, because even when Stacy talks about how many hours that you take away, it truly doesn't speak to it covers the fact, but also you got to realize that there can be anxiety that goes with that. So making sure that the staff were engaged and that we're being participative with each other in this movement, that the staff is understanding the changes, and also that we get the budget and the authorities that we need from the front office, so that it takes, I guess, the village has to be on the same page. And with my leadership role being engaged in it, that really gave me the possibility to be that central will that brought it all together. And so I do agree that that can be the greatest challenge, and the authority to operate, that IT piece of it was the most challenging of all, because when it's new technology, attended bots, unattended bots, you have to really cover the concern, the valid concern of security and what you're introducing to the environment. So making sure that we had the time, the long tent and the pole to address that was critical, because you really have to kind of clear those gates to be able to get to the floor. And so before I turn it over, I would be remiss being from NIH if I didn't quickly mention our new national hero, Dr. Fauci, who is a scientist here at NIH. And I was thinking, as Mitch was talking about many of the applicable places, I'm also the senior travel official for NIH, and science is done through collaboration. So that's a really big change too that's going to be addressed, is this collaborating between these different types of meeting venues, and then how you do make science happen whenever, right now, everything's remote. So those are 2 points I wanted to add.
Okay, and then great, because I'm keeping an eye on the time here. I know you guys have a bunch more questions here, and I think we have one more poll out there. So good. Everybody's increasing their use of AI and machine learning next year. So that's a great poll response or evaluating responses. Only I think maybe 1 or 2 people said they're not going to use AI or ML. So really great to see that. Last one for Doug, and then we'll do a quick wrap up here and we'll go. Actually, it's a combination of questions that have to do with the states. Kind of where are they? Are they ahead? The questions have to do with, like, you said 7 or 8 states were in production with chatbots. Which states are these? Who's ahead? We won't talk about who's behind, but like who's ahead. And I think maybe we'll do that, and then a quick wrap up, and we'll let you all get back to your workday.
Right. Well, I guess as head of a national association and a longtime executive director, I've learned that it's in my best interest not to rate or rank my own members. That's probably injurious to my tenure, and I still have a little bit of a mortgage to pay off, so I don't want to be in danger of having any issues there financially. I would tell you that I would probably put Utah in one of the market leaders. A lot going on in automation, have for many years. So they're not a late adopter, they were early adopter. And surprisingly, states that you would think about that we've actually recognized with national awards. Mississippi for their Missy chatbot, but also integrates with Alexa. So they've been big on digital assistants. Utah as well. If you want to find out where to go fishing in Mississippi, you can ask Missy, either for your Alexa or the chatbot, which is interesting. They have intelligent agents there. Arkansas was the first state to actually put a live chatbot out on their website back 4 or 5 years ago to answer general inquiries. So the states have been doing this for a while. We are attempting as fast as we can to actually track the states and produce a heat map of a combination of where states are using chatbots in both in the pandemic response area and health areas. I think probably the fastest growing area has been unemployment. And so we've noted about 26 states right now that have some chatbot in production serving citizens. I would point out Texas as one of the second largest state in terms of population, now 29 million. They had kind of a dramatic increase in unemployment, so they're a good state to look at in terms of what they're doing. They had a massive surge in demand for unemployment insurance claims, looking at 250 to 280,000 claims a week. I think they're up to 1.4 or 5 million unemployed at this point, and so the Texas Workforce Commission was working with Accenture, and they deployed a very robust AI-enabled chatbot, which runs on AWS cloud, and they have handled, they deployed that, I think, late March, and I know to date, they've handled almost 3 million queries on that chatbot, so it's really helped to balance out the load between the online web presence and their virtual call centers, and they did that in a matter of days and handled several 100,000 queries just within the first week. So they had a real surge. So I think Texas is a good one. Again, Utah, Missouri, South Carolina, Georgia, Ohio. Ohio has a thing called Baby Bots, where it processes information about babies that they're trying to push through. So lots of interesting things going on in the states right now. And I expect it to definitely grow in the next couple of years.
Yeah, that's fantastic. The baby bots and the fishing bots.
Yeah.
That's exciting. All right, well, maybe I'll turn it over to, I think our panelists did a fantastic job. So I think everybody should give them a round of virtual applause here or physical applause. And, and I'll let Mitch sort of wrap us up here and maybe any concluding remarks and where things are going with the ATARC RPA community as well.
Great, thanks, Ron, and awesome panel. Thank you, huge thank you to our panelists, Jan and Stacy, and Glenda and Doug and Ron for moderating. Yeah, great insights. Really valuable to hear what's going on at your organizations and what you're hearing from your colleagues and what you're seeing the greatest needs are from your respective customers and things of that nature. So great conversation. I think I was taking a lot of notes rapidly, and I think that some things that we're hearing is that there are some ongoing challenges, some things that we can do now, also some potential changes or shifts that we're probably going to see in the near term and the long term. But I think automation is here to stay. and looking at different types of RPA or AI tools that can help us do our jobs better and serve citizens better and support our employees' experience and external customer experiences is key. And we have a responsibility and an obligation to intelligently explore and integrate these tools and technologies whenever we can, as much as possible. So just wanted to mention that. Again, as far as moving forward, again, we're going to host more webinars like this. This was great. I hope we can get as many great speakers as we had today. Again, this is our fourth RPA and AI innovation seminar that we've had with this group so far this year. This is the first that we've had digitally. We had 3 in person earlier in the year, but we are planning to host a series of these events throughout the remainder of the calendar year. Probably about once every 1 to 2 months, we'll have another webinar. We have a few different topic ideas that we've lined up. We've heard some great feedback from some different members of the ATARC AI working group, as well as other folks in industry and government and academia. So, so stay tuned. We're hoping to be able to schedule another one for late June or possibly July on some different topics and be helpful and continue the information sharing and the networking and the collaborating. I do know that ATARC has some other events outside of this group that are happening. I believe there's a webinar. I think Maddie's trying to send me a note. I think there's an ATARC webinar this Thursday, the 14th at 1:30 p.m. on a different topic. I'm sorry I don't have the title in front of me, but again, there's a wide range of things happening around emerging technology that ATARC is involved with. So stay tuned and look for the events page or the webinars page on ATARC's website for more information, as well as LinkedIn. So with that, just wanted to say thank you again to all of our panelists and to our moderator, to everybody at ATARC, and a huge thank you to everybody for calling in and attending. We had a big group. Thank you for your participation and for your great questions. Really helpful to hear everybody's feedback. But everybody stay safe and stay well, and we look forward to seeing you next time. So thanks again. Have a great day. Bye, guys.
Bye.